Welcome back to State of Addiction. It's a drug saving lives once only used by emergency responders. Some families are now using naloxone to save their loved ones.
Naloxone, or Narcan, reverses the effects of an overdose. Gianna Caserta takes a look at how families are using the drug to battle addiction in their own homes.
Everything happens for a reason, and I'm thankful that it did happen because I have a new lookout on life.
Nathan Johnson says his overdose was the wake-up call he needed.
I had got what I thought was some heroin, and I went over there and I went in the bathroom, and dude told me it was strong, so I did just a tiny bit of it. And they found me in the bathroom against the door with the needle in my arm.
And Johnson isn't alone. Metro EMS responds to hundreds of overdose calls each month.
They threw me in the shower. They did 18 minutes of CPR till the cops got there. Nothing was working. So the cop came in and he had to use 2 Narcans, but it brought me back to life.
Naloxone, or Narcan, is a drug which reverses the effects of an overdose. First responders use it dozens of times a day, and in some cases, multiple times on one patient. But it's not just first responders using the drug. Families are buying it so they can be prepared if a loved one needs help.
His disease goes in and out of remission.
Jennifer Stepp's oldest son has battled addiction for years. She's used naloxone to save his life.
And then after it was all said and done, everything worked out fine for that evening. Everything was fine, and it turns out a life was saved.
Jennifer has since taught her daughter how to use naloxone in case she's not around to help.
She said, Mom, how come you haven't trained me yet?
Her reason for wanting to learn was simple.
Because I wanted to save somebody.
They're people that we love, and they have value.
More needle exchange programs are opening in counties on both sides of the river. Proponents argue providing addicts with clean needles prevents the spread of infectious diseases such as HIV and hepatitis C. A Scott County man says the needle exchange changed the course of his life. Carolyn Callahan has his story.
Put it in there so that it never can stick anybody.
If you had told Cole Boyd a year ago he'd be helping clean up his community of Austin, Indiana, he would have thought you were crazy.
Wasn't there for my daughter, homeless, addict.
Boyd was an addict for years. It started with pain pills after surgery and progressed to heroin and other drugs. Last year, he went to the Scott County Needle Exchange to pick up clean syringes, but he ended up with a whole lot more.
And the people at the Needle Exchange program showed me a way out.
The Needle Exchange program helped him get into recovery programs. He's been clean for 6 months, and now he's giving back with dozens of other volunteers.
A third of the calls at Austin through 911 dispatch is about a dirty needle and someone's afraid to pick it up.
Before heading out, volunteers learn how to safely pick up a needle and where to look for them. Most are found on the side of the road. Scott County received state approval in 2015 to open its needle exchange. At the time, the county was experiencing the state's worst ever HIV outbreak. But for Boyd, he says the program can be a lifesaver.
It's more than just a needle exchange. It's an opportunity to get to the people who actually need some help and show them there's a way out.
WLKY was proud to work with Louisville's Drug Enforcement Agency on its recent National Pill Take Back Day. This year's event collected a record amount of pills nationwide. Here locally, we doubled the number of medication collected to nearly 3,000 pounds. Mark Vanderhoff looks at the importance of the program.
Getting rid of unused prescription drugs to keep pills from falling into the wrong hands.
You want to make your house as safe as possible, especially if you have kids around or even teenagers who might be curious. And you also don't want to leave yourself open to having medications around that someone would either break in to find or go through your things to find.
According to the U.S. Attorney's Office, more than 2,000 people try prescription drugs for the first time every day. They're often getting pills from the medicine cabinets of family and friends.
You definitely don't want those around your house. They could be extremely dangerous if someone got them, on accident, and they're extra potential for someone to be looking for abuse.
Maria Chapman is the poison prevention coordinator for the Kentucky Regional Poison Control Center. She's a big advocate of people properly disposing of their unused, unwanted, or expired prescription medications.
If it's a prescription medication, it's expired, it's probably not part of your doctor's current treatment plan for you. It's probably left over from something, and you don't really want to ever self-medicate like that. You certainly don't want to share prescription medications with friends or family members, even if it seems like they have the same symptoms you had. Really best to talk to a doctor and get them their own prescription for whatever's going on with them.
The DEA warns that throwing medication in the trash or flushing it down the toilet poses potential health hazards. Those medications could actually end up in our water supply. There are ways to safely get rid of prescription pills outside of drug take-back events. Chapman suggests dumping pills in a bag of coffee grinds or used cat litter. Anything that would deter someone from digging through to find it.
WLKY is dedicated to bringing attention to the state of addiction. We hope that you take this information presented today, discuss it, and pass it on.
If you or someone you love is struggling with addiction, go to WLKY.com or our mobile app and click on State of Addiction. For WLKY, I'm Rick Van Hoos.
And I'm Jennifer Bayless. Thanks for joining us.